let's start. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good afternoon, everyone. First of all, happy Ramadan to everyone. On behalf of the Health Academy, I'm Dr. Sayyid Arifi. Welcome you all to the webinar on communication skills in the workplace. It is something that each and every person in the world does, which is communication. In fact, when it is the first thing that we do when we exist on earth, meaning when a child is born, the first thing that he or she does is an outcry, which is a communication to the world that they're there. And sometimes, therefore, because that the nature of communication, and because that we communicate every day, we take communication for granted, because we think that we do it every day and we are good at it. However, at times that is not the case, especially at workplace, where communication skills are very important. For this, we will, inshallah, talk about communications with our distinguished speaker today, Dr. Dina Marwan Ata'Allah. She holds a PhD in health sciences in oncology nursing. She has a Master's of Science degree in nursing, SCDP oncology nursing, and she has great interest in research and published many papers as well. We are very proud to have her today as our distinguished speaker. And before I hand in the mic to Dr. Dina, I would like you all to ask any questions that you might have in the Q&A section during the session. And then once Dr. Dina has finished or completed, if I may say, her presentation, we will take questions and answers. So, and then also at the end, once the webinar is completed, you would have your surveys link where we want to hear your voice about the webinar in general. So without any further ado, I would like to call upon our distinguished speaker, Dr. Dina Ata'Allah, to please come and present this talk.
Thank you, Dr. Said. Hello, everyone. I hope my voice is clear.
Yes, it is clear.
Yes. Thank you so much. Okay. Before we start our talk today, I want to say that thank you all for joining this lecture. I will speak for about 35 minutes or more, and afterwards, please feel free to ask any questions. Today's talk is about the communication skills in the workplace. Communication skills are probably one of the most important skills in the workplace in general, and in the medical field in particular. So as Dr. Sayed says, everyone has to have a communication in kind of like verbal, non-verbal, and we will know about this thing in today's lecture. So the objectives of today's lecture are: define and understand communication, identify the importance of communication skills, recognize the elements of the communication process, describe a model for effective communication, differentiate between verbal and nonverbal communication, list strategies for enhancing communication, and finally we'll end up by talking about identify the ethics of good communication skills. This talk is general, however, because I'm in the medical field, so my example is going to be from the healthcare professionals. Next, please. Communication is an exchange of thought, feelings, beliefs, information, and once between two or more people. So it's not necessary to be between one person to other person. It could be between one person and a group, or between a group and a person. And we need to know what is communication. Communication has been defined by Dalton McFarland as the art of transmitting information, ideas, and attitudes from one person to another. Communication is the process of meaningful interaction among human beings. And as a healthcare provider, our ability to communicate would have a positive impact on health and well-being of the people in our care. Next, please. Okay, let's move to the importance of communication skills. It is really important. Why? Especially in the medical field, because we have to establish and maintain the therapeutic relationship between us and between the patients and their family, also between the workers themselves. I mean, between the healthcare professionals and other workers in the hospital or in the workplace. Also, to diagnose and treat disease patients with patients. Also, to offer information and educate patients and their families, as well as healthcare colleagues. For example, what we do in our field, we are exchanging our knowledge. So communication is really important to just give the right information to the rest of or the receiver. Next, please. Now we need to know about the elements of communication. As you can see from this slide, we have 4 elements: sender, receiver, message, and feedback. Let me talk about each element. The sender is likely a nurse care assistant or any other worker, a patient and his or her family, other healthcare professionals. The sender can be an individual, group, or organization who intends the communication. Now, we have to say that the sender experience, attitudes, knowledge, skills, perceptions, and cultural influence the message. So what is the message? The message is the idea that we want to the other person to receive it. So the receiver is likely the patient, his or her family, healthcare professional, or other colleagues in the work environment. So, as you can see from this slide, this is the communication models. As we can see in the sender, on the right side, we will have the receiver, and we can see the arrow is really like marking the talk or the communication from the sender to the receiver. And in the way back, we need to have also to check the message if it's confirmed by the receiver. Is the receiver understand what we were saying, or what we were talking about, or what we were educating? So this is a simple model of the communication. So the elements here, it's really appear, sender, receiver. And between them, we need to send the message and return the message back. So now we need to know about the communication methods. So as I said before, we have 2 types of communication, either verbal communication or nonverbal communication. So let's know more about this in the next slide, please. So as you can see, the verbal communication, um, it involves the use of spoken and written language, as well as the sign language. You can see from this slide, there's the sign language, which is by hands, and also we have the speaking and written language. Example of written language is reporting. As a nurses, we need to report the patient's situation to the doctors and to the other colleagues to have a complete information about the patient health status. So reporting is one of the important elements in the nursing work. Reporting is the verbal exchange of information between members of the healthcare teams. Sign language, it's known as the language of hand movement used by many people with hearing impairments. Next slide, please. While the nonverbal communication is the totally opposite. Nonverbal communication is the sharing of the information and feelings through body language. It's not like the verbal communication, including gesture, body position, movement, facial expression, and tone of the voice, also the eye contact. Yes. As you can see from the slide, the body language can be through the hands, can be through the facial expression, or through the body position. It can be in a different way. Body language is the language that body speaks to the eyes rather than language speaking to the ears. Also, as I said, that eye contact is one of the most important communication skills that all workers should have effectively using. Here, this slide, I took it from the American Red Cross. It shows that the tone of voice, like moderate volume, calm, relaxed, pace, clear. So this is the send of positive messages, while the negative messages from the tone voice can be if the voice were too loud or too soft, if it's sharp, sorry, because I cannot see the screen, if it's sharp or if it's loudy. While for the facial expression, for sure that the positive message can be first by smiling, concerned, depending on the situation. So we should not smile in front of the people that they are in crisis, for example. So we need to choose the right time for the right expressions. Where the negative message can be through the frowning, eye rolling, so that show that you are not interested in the others' talk or conversation. Gestures, they send a positive message, sitting down, patting a person's arm or holding a person's hands. So this is like a type of tactile, giving a patient or the other person, the receiver, like a positive impression, nodding as a person speaks, making good eye contact so that the receiver will know that you are in with them, you are interested in what they are saying. In the negative messages, checking watch or looking toward door. So one of the most important thing when you are communicating with others, you should look at their eyes, and avoid looking at the windows or like making yourself busy with something else. Let your eyes have a direct contact with the receiver. Body position and movement. So leaning toward the person as he or she talks. For example, if we are talking to the patient in the bed, we can lean to the patient like in a way that showing the patient, yes, I'm interested in your talk, I want to hear you, I'm listening to your complaint. While if the nurse or the healthcare providers, they are away from the patient and they are not looking at them, so that's give the patient a negative impression. So standing over the person, crossing your arms, so this is something really not acceptable. Tapping your feet, also this is one of the negative messages that we should avoid. Next please. Now we have to know about the strategies of effective communication. As healthcare provider or as a worker, we should develop strong communication skills, as it's integral to becoming a capable health provider or worker. Just remember, effective communication benefits healthcare provider and the one who received the care. So as you can see, we have 7 strategies. The first one is assert yourself and keep stress in check. Second one, focus fully on the speaker and pay attention to nonverbal signals. Also, show your interest in what being said. Also, you have to avoid interpreting or trying to reduct conversation to your concerns. Also, provide feedback to the receiver, just to make sure that he or she understand what you were talking about or what you want to give them from information or education. Also, try to set aside judgment. So you should not judge what the other says. You have to be a good listener. Explain things clearly in plain language. So use the white language rather than using complicated terminology. For example, if I'm talking to the patient, I should not use a very specific terminology. I should make it simple for the patient to understand it. So next, please. Ethics of good communication skills. This is really important, and all of us, we should bear in mind these things. We should be a good listener, so we have to learn how to listen to others, learn to respect others, maintain eye-to-eye contact, avoid being emotional, avoid using complicated medical terminology, as I said in the previous slide, present acceptable tone of voice and body language. So it's really important. Sometimes we cannot, sometimes we are saying something really polite, but in a bad way. For example, if I use my hands or avoiding contacting the patient in their eyes, so this is giving them a negative impression rather than the good message that you want to give them. Do not use offensive language. You should be polite with the patient. You should also consider what type of patients or what type of person that you are communicating with. For example, if you are communicating with a person who has difficulties in hearing, so you should be really clear. You should come to next to the person and try to speak slowly, and you should speak. Your voice should be really clear, in a clear tone. Also, if you are communicating with people who cannot see, what you should do is you should If the patient cannot see you, you should be next to the patient. Try to touch the patient. Give them an impression of that I'm here for you. Even if you are not seeing me, I will try to help you. Also, we need to think about how to communicate when we give patients or their families a bad information. For example, breaking bad news in cancer patients. So, if the patients cannot tolerate the message, we should give it to their families instead of the patient themselves. While it's the right of the patient to know what they have, however, sometimes we need to see what is possible. And also, when we are talking with people, with elderly people, we need also to be polite. We need to respect them. It's the totally opposite if we are contacting with the and communicating with the child. So we need to be more vital. We need to be. We need to speak their language. We need to be clear so the child can understand us. Now, the message from this short talk is you should choose your words wisely. Communication is not what you say, it is how you say it. And actually, communication is really a big topic. It cannot be covered in 1 hour. So that's why I decided to give you a clue about communication. And if you have any question, please feel free to ask.
Thank you so much, Dr. Dina, for a great presentation. I really appreciate all of your effort in this regard. I've been receiving questions from our participants in the Q&A section, and
Yes.
I will ask these questions on behalf of them, as the setting for the webinar does not permit that they would ask these questions directly. So one of the first questions from one of the participants, Ms. Fatima Ghamdi, is asking, what are communication skills and how can you develop them? So she's asking more on development, on how she can develop her own professional and personal communication skills.
Actually, this is a great question. Communication skills, that's something you should learn, and you need time to learn it. For example, if I know something about my personality and I need to change it, it will take time. Also, the communication skill, the effective communication skill is the same. So to build up good and effective communication skills, you should take it gradually. You need to know your weakness and your strength and work on it. So building the communication skills needs reading. You need to get workshops on how to communicate effectively with others. Is that answer her question?
That's correct. And if I may add also, as Dr. Dina mentioned, that it is very important that we practice our communication skills, also observe those who you think are doing good in communication. We observe them, the body language they have, the way they speak, as well as how to conduct any communication with others. You could, as Dr. Dina mentioned, you can relate to them from different references, from different workshops, as well as now on YouTube and many open source platforms. You could see many videos on communication, and they're actually very good resources available on open source platforms on communication. We have, yes, Dr. Dina would like to add something, please go ahead.
I suggest the book which is available in my references, which is the Effective Communication Skills in Nursing. practice. This book is really, this article is really a great article. It's giving a clue about how to work and communicate effectively. So I recommend this article.
Excellent. Excellent.
Yes.
We have another question, Dr. Dina, from Ms. Haneen Isawi, one of our participants. And she's asking about the best way to put a question without sending a negative message. And she thinks that it is very challenging, especially if the question is intended for a leader or a head. So how to do that?
Good. Actually, you need to know whom you are talking to. And if you have an idea about their personality, you should choose the right way of communicating them. So be calm, even if it's a complicated question or giving a negative impression. So try to be calm, make it direct. You don't need to use high tone. You should be polite when you are breaking the question. And also, when you communicate with others, you should also use the body language. The eye contact is really important. Showing the interest in this question. Show by body language your interest on how to find a solution for your question, or if you have an answer to your question that you want to send it to the receiver, I mean your leaders or the boss in work. So just try to make it easy. Don't show them that you know everything, because no one know everything.
Excellent. And it is very tricky. If I may add, it's very tricky when it comes to making sure that when you're communicating with your heads, at times it is tricky because if there is a question that might be received as negative, so and that's what your fear is, then you should also make sure that you make that understanding with the person you're communicating, in this case your head, very clear on the assumptions that you have and any reservations you have before you communicate, so that they don't take it in any way different than what you are intending them to answer. And these are sometimes called, please go ahead, Dr. Dia.
And also, if you see that the receiver cannot absorb your question, try to simplify the question. Make it simple.
True. Exactly. And this is the area in communication that we also relate to as difficult conversations at times, when feedback is also involved with not only the leaders but also your subordinates. And there are quite a few things that you can study in detail on difficult conversations as well. Yes, we have a next question. Yes, Dr. Dina, would you like to add something?
Yes, and to choose the right time.
Yes, that is correct.
And the right place.
Very
asking the question.
Truly. We have next question, a very interesting one by Mr. Wabi Al-Utaibi, and she's asking about the causes of poor communication in healthcare.
Well, we cannot judge that everyone is communicating in a negative way. For sure that I'm sure that there's positive examples. So we should see always the positive people and not to like focus with the negative. So why in the medical field we have a poor communication? I can say that sometimes it can be regarding to the language barriers. For example, if the healthcare professional cannot speak the same language or the accent of the patients or their family or their caregiver, sometimes the message is not gonna be sent smoothly, and the patient can understand it in a different way. So from my point of view, anyone working in a medical field, they should be train themselves all the time on how to effectively communicate with patient and the families. So we need to start with ourselves before seeing others. So if we try, if for example, if I'm the head manager of a unit, what can I do? I can give a workshop for my colleagues in the units, helping them to work and communicate effectively. Try uh, um, to like engage the effective communication skills in the units. So we can do a lot to improve this situation. So it's not necessarily to look at the like a big workshops. Sometimes a simple talk can help. And also the poor communication skills can be related to the some of the healthcare givers. When they are busy, they are not listening, and this is not acceptable. The patient rights is to listen to them and communicate with them. You need to give them time. So this is two barriers of effective communications.
Truly, and sometimes, if I might add, in hospitals and in healthcare settings, we as healthcare providers are so busy that at times it's hard for us to manage the communication. So, for example, if I'm on the front desk on a nursing station or on a reception, I would have people in front of me, standing in front of me with queries, and then I would also need to attend the phone calls while I was trying to fill in a medical record, a medical report on some patient record. So therefore, it gets very tricky. And as Dr. Dina said, it's not necessary that we have we attend huge workshops. We could work on our communication skills in a way to first understand what are the demands of communication at our workplace, and secondly, how we could manage it in the best way possible. And then we keep on reading and doing, attending workshops to make sure that we're doing the right thing and practice as much as we can the best practice and communication skills. There's another interesting question anonymously asked by attendee is, how can we communicate with someone who does not understand the languages that we speak, meaning Arabic and English? How could we communicate with such a person?
Okay, this is really interesting. If the patient or the family, they are speaking different language, so what can we do? First of all, we will try to find someone who can speak their language. And if it's not, sometimes using a body language can help the patient and their families to understand what we want to do or to say. So body language is really a type of communication, which is the nonverbal communications. So sometimes the eye contact can help, and also use the sign language, which is using hands, or like trying to find layers for the patients that will help them. And sometimes even the smile can help. So if the patient speaks different language, it's not a problem. We should give them as much as we can. Try to find a way of helping them to understand what we want to say. And if it's like possible to bring a someone who can translate to them, it's going to be really perfect. But if it's not available, so use the equipment and flyers that we have to help the patient.
Truly, and try to innovate The most important thing is that in communication that we understand completely what they want to say to us. And also once we say it to them, to the receiver, being us as sender of the information, they need to understand completely. So as Dr. Dina said, we can also innovate, use Google Translate, ask them to use the translation, or have different apps now being are translating even voice messages. So we could consider using that, but definitely we'll have to, if there is no translator available, we have to understand them completely
We can
before
show the
we guide
patient pictures also.
them.
If
Yes,
it's regarding to the diagnosis, we can show the patient's pictures
excellent,
or
excellent,
videos. Something can help them.
excellent. Very interesting question. We have another question asked by Rida Al-Bahrani, one of our participants, is that what if the patient is the one who is using offensive language, and what is the right thing to do in such a situation?
Okay, it's a good question. Just remember that nursing is an art. You should know how to communicate with others, even if they are sometimes harm or if they are using offensive language. You should be more um, open-minded. So, but to a limit. So if they just try to let the patient or the family giver to understand that this is a professional place and you should talk in a polite way, and if they are start to continue with their offensive language, we can simply ask the security um, to come. So but don't use offensive language with the patients even if they are the one who's using it. I don't want to say that you should ignore, but sometimes we need to bear in our minds sometimes the patient's under pressure. And for example, if I'm giving information to, for example, cancer patients, and if they say offensive word, for sure that they are not meaning this offensive word. However, it's come out because of the pressure they got or the bad news they received. And we need to be careful when we communicate with these types of patient or their caregiver. As I said, that we can contact the security and we need to show them. We need to let the patient calm before we talk to them. Even give yourself a chance to calm down before you communicate with the patient.
Truly, not to react if you're angry, as
Yes.
Dr. Dina said very rightly, and try to be calm in the situation. There are certain codes in the hospital that you could use. Some hospitals use code white as asking for security for such a troublesome person, and some others use other codes. The in, you should, in principle, make sure that first of all everyone is secure, and also to make the person who is getting angry or using offensive language understand that this will not help them resolve any issues. Try to assure them that you and the team are doing everything possible to resolve their issue that they are being angry about. However, if they continue to use offensive language, that then you might not be able to serve them, so that they get a sense of responsibility as responsible patients or citizens, that they need to conduct their communication in a professional and ethical manner.
Also,
It's a very difficult situation.
we need to follow the hospital or the primary care unit
Care center, yes,
policies. Yes,
truly. Yes, the organizational policy.
yes.
That is correct. Many, mashallah, questions being asked. I'm trying to skim through them and ask you those questions. We have a total of 49 questions right now. One of the interesting questions Mr. Riham Ashari asked you is that if you could please clarify the point in your presentation about avoiding being emotional.
Yes. As I said that, I'm sorry because I'm in the oncology field, so all my examples from the oncology.
That is okay, doctor.
Yeah, so avoiding being emotional, for example, if you are communicating with the child, and if he had cancer, and the mother, she's crying, and you have to tell her that your son or daughter going to be palliative patients. So you should not like you should like separate your work from your emotion. So you should not be really like in patient stories. Otherwise, um, you will be depressed. So we should. That's why I'm saying again and again, nursing is an art. One of the art of the nursing that we need to separate our emotion from others' emotions. I don't want to say that here we have to be like a machines. No, we need to give um, the families the support. However, but not to involve ourselves in their stories.
Truly, I totally agree. And sometimes it's very difficult to communicate, and this will also by experience and by dealing with them more, you would gain that
Strength.
skills even more to talk to them in an efficient manner.
Yes.
That is correct. So we have another question regarding the challenges. So Ms. May Al-Zamil asks us if we can identify for them the challenges that newcomers in the medical field face when it comes to communication.
There is many difficulties. For example, one of the difficulties that might face the new worker is um, engaging with the rest of the team, because as you know that each one of us has different attitudes, different personality, different way of talk. So sometimes you need time to engage in the team. So this is one of the challenges. So what you can do is, you have at the beginning, you should observe others, and you should know them more before trying to be really like to speak with them in different things that other than the work itself. So one of other challenges that can face the new workers, uh, um, different cultures. For example, I used to work in a place where I was the only Saudi nurse in that unit, and I found myself isolated because the rest of the my colleagues from other nationality, and all of them, they were speaking the same language. And I found it really difficult to say that, no, stop here. You should communicate in English, because the English is the first language in the hospital. And if I'm around, please use English language. Or if you can't speak Arabic, that's fine. This is what I can say now.
That's a great point, Dr. That one of the things that we need to understand when we step into the healthcare field is that the the multicultural workforce that is present in healthcare, you might not find it in any other industry. When I used to work in Sultan Abdulaziz Humanitarian City, we had 50 plus nationalities working in the hospital at any given time. We used to call it a mini United Nations, mini UNO. And that brings positive as well as some weakness when it comes to aspects of communication. Most importantly, we also need to understand different cultures and try to respect those cultures. And yes, there are boundaries, there are fine boundaries, as Dr. Dina mentioned. And this is in our deen as well in Islam, that if the communication is being done, if we are three people in a room and two of them talk a language that the third does not understand, then we should talk in a language that everyone understands. And same goes in the healthcare field when it comes to communication with colleagues. There should not be, and organizations don't permit by policy to talk in languages that are other than English or Arabic, which are the official languages. And that could be a challenge. However, most challenging for you as newcomers is to understand cultures and understand. So what I mean by cultures, and one of the questions is about the culture as well, or the formalities of communication. Or there's another question that I will add to this discussion is how can we understand, do we need to learn sign languages? No, you don't need to learn sign languages, but we need to understand different body languages of different cultures. For example, it is okay for me to go ahead and extend my hand to shake to any opposite gender if I am in, for example, a Western country. It is very okay. Or in other words, it is offensive if I don't shake hands with opposite gender. But over here in the kingdom, in our culture, this might be perceived as offensive. However, there's a country in the world where me being a male should not extend my hand to another male. I should not extend my hand. I'm talking about pre-COVID, before COVID happened. Right now, you cannot shake hands with anyone. There you go. However, I'm talking about pre-COVID, before COVID. If there's a country in the world that if I extend my hand to shake with the same gender, meaning I am a male and in front of me is a male, and I want to share my shake his hand, it is considered offensive because they bow to each other. This is Japan. So therefore, we need to understand also, we don't need to understand sign language, but yes, we need to understand the cultural aspects of those different people that we are working with, so that we can better understand them and have a better communication with them as well.
Yes, and there's a point I want to add here.
Yes, please, Doctor.
Never correct others' culture. For example, even if you are seeing something it's really against your culture, so just leave the patients or their caregiver to practice their culture as well. So unless if it's offensive or against our work, I mean our Islam as well, our religion. So don't correct others. This is an important information. You should like have it all the time in your head. Don't correct others.
Truly, that is correct. There's another question, Doctor. Yes, go ahead. You wanted to add something, Doctor?
Thank you.
There's another question we have from Ms. Aisha Al-Suleiman, that she says that she's naturally a very loud speaker, and it is considered, and yes, it is considered a negative attitude. And how can she resolve this misunderstanding?
Yeah, by training. She should, and everyone should train themselves to be speak with acceptable tone. So it should not be really loud or really soft. We should train ourselves on speak in the middle. Otherwise, the others can take us wrong.
Truly, that is.
So it's going to be easy for her by training. She can change.
Right.
And everyone can change with practice and
Truly.
training.
That is correct. Ms. Fatma Al-Majhad asks if there is any conflict or disagreement between team members during a meeting, and how can they best resolve this communication in such a situation?
Okay, communication between the colleagues should be healthy. So for example, if there is a conflict happen between two, we should allow time to give myself, for example, a time to think about the situation, to think about if I'm wrong in this point or not, if others were right or not. And also we need to, as I said, that we need to accept the differences between our attitudes and personality. So give it a time, try to think about it in your head. Afterwards, you should go back to the same person, because solving the problem is really one of the most important art in nursing. So don't keep the things to yourself. You need to express your feelings, because this is a way of solving the problems. So to solve the problem, you should go back to the person and talk about the conflict, and try to give them um, your ideas in polite ways. Don't like use offensive language, or like high or loud voice. Try to communicate with the people in the same language. Use the right time. Use the right environment. For example, don't solve the problem happen in during meeting while working with the patients. For sure that the receiver should be busy with what they are doing. So try to find the right time, the right place to talk about the conflict and solve.
And thank you so much for answering the question very comprehensively, Doctor. There's one more interesting question from an anonymous attendee, is that can he inherit bad communication or adapt any bad communication? I think this is what he meant, without noticing, from the people around them.
Yes, it's possible. That's why we need to, as like Islam taught us, we need to every single day after work, we should like, I don't want to say judge ourselves, but we need to go back to the tape of the day and check what did I do right and what did I do wrong, and I should correct myself before like be in before being in trouble. So yes, sometimes there's an influence from the environment on our behaviors, our attitudes, but we should be careful. We should um, go back to what we did earlier and think about it. If we did the right thing, yes, we will continue. If it's a bad thing, we should avoid it.
That's very correct. Thank you so much, Dr. for that. One of another very interesting question asked by Ms. Khulud Atri is that how to communicate with colleagues who question your authority or your place of work.
Sorry, say it
Interesting
again.
question. Interesting question. She asked that how can we communicate with colleagues who question your authority or your place of work?
Question the place of work? I didn't
Uh,
get it.
so basically what she means, I think, is that those colleagues who don't understand or have a question on your authority, they will not take
Yes.
directive from you. How can you deal with such colleagues? Who I think, if I could answer this question, is sometimes it is very difficult when you're communicating with colleagues who challenge your authority, for example. Uh, for first, there are hierarchies in communication. If, like, for example, manager, and this hierarchies or communication policies are dictated by organizations and organizational policies on communication. So, for example, if I'm a manager of a certain hospital, I will not directly communicate with a CEO of another hospital. In order to do that, if I need to communicate to another CEO of the hospital A, and I am under hospital B, a manager of a certain department, I will ask the CEO of my hospital B to communicate to the CEO of the hospital A. So these are called organizational policies when it comes to communication, or hierarchical policies. And this is the same if you follow in your hospital. If you are, for example, communicating, or you want to communicate some piece of information, or you want to ask something, some piece of information from another department, you will either ask your counterpart having on the same line, or you will ask your leaders appropriately to help you out in the communication with the different department. This would hopefully decrease your challenge when it comes to people question marking or asking you or challenging your authority. So you follow the hierarchy in the organization, and you should not face any trouble. I hope I answered your question. Now, there's another very interesting question about body language.
Yeah.
And Mr. Saad asks, Al-Dosiri asks, how can she control her body language, especially the face reactions?
Well, sometimes the facial expression, sometimes it's really helpful, and sometimes it's not. So if it's not related to, like, it's not effective when sending messages to the patient, we should stop it. But sometimes, for example, the eye contact, we need to have an eye contact, a direct eye contact with the patient or their caregiver to show them that, yes, we care. But if I'm keeping my eyes rolling around the patient and not to look at them, so this is type of body language which is giving a negative impact to the patient care. So using the body language, sometimes it's really effective, especially with the people who cannot, for example, hear well, or for example, with the child. So we need to be more active. However, we should know exactly what type of body language we should use. And also, in other way, we should not overuse for example, the hands, or shaking heads with the patients. We should be really communicating in a professional way.
And it is very important to be aware of your body language.
Yes.
Body language comes under nonverbal communication, and we should be very aware of our communication. As Dr. Dina said, if we are rolling our eyes, or if our body language is in any way offending the patient, you will have maybe you might have very tough reaction from the other side, and you would not realize why, because you're saying the right words. However, the patient and the customer you're talking to is not only listening to your good words, but also watching your body language. So he is receiving a message, he or she is receiving a message, verbal and nonverbal. So it is very important to be right in your nonverbal communication as well. There's another question, very important. Mr. Ruqayya asked, is how can we maintain the positive communication even under high pressure situations in the workplace?
This is gonna come with experience, because, for example, the novice nurses, it's not like the expert. For sure that with the time, you will know how to handle the pressure at work. So yes, it's an art again. We should control our behavior, our communication language, our voices. We should control our communication skills. So in a way that it's not going to affect others, either our colleagues or our patients. So yes, we have to, and it's going to come with experience.
Truly, it definitely will. Thank you so much, Dr. Dina, for your great presentation, as well as answering so many questions for all of our participants. We highly appreciate, on behalf of Health Academy, your participation as a speaker. It was highly beneficial for all of our participants, and I thank all of our participants also for attending today's webinar on such a important topic. And we hope everyone is enjoying their Ramadan and their fasting. May Allah accept our good deeds and our fasts and our du'as, as well as may Allah remove all this wabah that we have, this disease from all over the world, the COVID situation, and we get back to our normal life, which is such a huge blessing that we have realized. Thank you so much, everyone. I would just like to again remind you that once we end this webinar, you will receive the survey link. Please fill that link so that we can listen to your voice. And my apologies, we were not able to take the questions. Excuse me. Because of shortage of time, and mashallah, so many questions. I tried my best, and Dr. Dina, mashallah, answered more than 22 questions today. However, they were overwhelming questions today about communication. So we would like to please hear from you through the survey link. Once this webinar closes, you will receive that. We are very keen to listen to you. Thank you so much, everyone. So thank you again, Dr. Dina, for your participation. We highly
and just to make it like more communication skill is really a big topic. We cannot cover it in 1 hour. That's why I tried to make like and to give you only a clue about the communication skills. However,
Truly.
maybe in future, inshallah, we can give you more information about certain things in the communication skills.
Truly. It's a huge topic, as Dr. Dina mentioned, and there are so many areas or let me say subspecialties in communication. For example, communication when it comes to business writing, conflict resolution, patient management when it comes to difficult situations. Yes, Dr. Dina?
Breaking bad news to the patient.
Breaking bad news, difficult conversations, all of this. There's so many areas, as Dr. Dina mentioned, and therefore, yes, mashallah, today she did a really great job encompassing the general communication skills at work. And inshallah, if you have more, then we're all ears. We'll have more sessions. Thank you so much, all, and have a great day on behalf of the Health Academy. Thank you so much.
Thank you.